The NASCAR world is still reeling from the tragic loss of legendary driver Kyle Busch. Tributes continue to pour in as fans react to Busch's sudden death after severe pneumonia quickly turned into sepsis.
I wish I could have caught it a little earlier, instead of, pneumonia could have been treated.
No illness should ever be thought of as nothing serious. Who would think a sinus infection would lead to what it leads to?
It's hard, being 41 years old. He's young, he's fit, he races every week.
So let's bring in Dr. Stephanie Widmer, attending physician of emergency medicine and director of medical toxicology at St. John's Riverside Hospital. Thank you so much, Dr. Widmer, for coming in. This is just so tragic. I was watching the race and the finale when they brought his family out and his wife and his little children. It's so sad. 41 years old. How rare is this?
It is incredibly rare. And now we don't have a ton of information as to what happened and what the course of the illness really was. We're working with minimal details here, but for a 41-year-old to pass from pneumonia, who was otherwise healthy, presumably, very rare. We're talking like less than 1%, very unlikely.
We have that 911 call. Someone who was with him ended up calling 911, and he was coughing up some blood. Listen to this.
I've got an individual that's shortness of breath, very hot, thinks he's going to pass out, and is producing a little bit of blood, coughing up some blood.
Is he awake?
He is awake. He's awake. He's on the bathroom floor right now.
Signs of sepsis?
Very concerning, and when pneumonia or other infections progress to sepsis, really every minute counts because patients can deteriorate very quickly.
Yeah, the coughing up the blood, that would be definitely very alarming. There's some warning signs of when pneumonia can become severe. Difficulty breathing, chest pains, high fever, confusion, blush color in lips and or fingertips. So what exactly is sepsis?
So sepsis is the body's overwhelming and erratic and frankly dangerous reaction to an infection. And once sepsis is triggered, it can start to affect different organs. It can affect the lung, the heart, the brain, kidneys, and really patients can get sick very, very quickly once sepsis is triggered.
Is there anything that they could have done? They called 911. I'm sure he went immediately to the hospital. Is there anything that the doctors could have done at that point?
Now, it's really hard to say, but especially for something like a pneumonia, it's very easy for people to confuse it with, a run-of-the-mill viral illness. So it's really important to pay attention to your body, to look for those signs like chest pain, shortness of breath, confusion. And if you are being treated for a pneumonia, let's say as an outpatient, if you're on antibiotics and a couple days go by and you're not feeling any better, or you happen to be getting worse, it's probably time to go get evaluated. Maybe those aren't the right antibiotics, but you really have to pay attention to your body. And if you just have the question in your mind, seek medical attention.
Okay, doctor, thank you so much.
His
last interview was with Sean Hannity, and I listened to that over the weekend, his podcast. And he talked about his son. His son was 10, just turned 11, and how he was going to, take over the racing world too. And he's a really good racer as well, but it's just tragic.
Heartbreaking.
To have a little girl too. Thank you so much.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox 1.